this is our last day, right? Last letter writing session thingy, right? We're gonna do something which is going to help you in identifying how many kinds of letter there might be. And I know I've been saying it repetitively that there is no such thing as transfer letter in itself, right? Like a simple, like they say that tell me which is a transfer letter that I should practice. You guys are having conversations around another that there is a transfer letter, there is a discharge letter, and then there is can you guys tell me any other kind of letter that you've heard about during all this while of practice? Any other letter that you've heard of? Transfers, discharge, referral, what else? I need names. What else have you heard of? Dr. Zishan, Dr. Moaz, Dr. Deepa. Yes, Dr. Rabia. Have you guys heard of any other kind of letters? Transfers, discharge, referral. Can you hear me, by the way?
Urgent referral.
Update.
Urgent referral.
Update. Okay, urgent. Okay, like urgent, update, and anything else? Any other letter that you have heard of? Because if you don't
referral letter.
Emergency. Okay, what else? Anything else? Update. What else? Information. Yeah. What else? Anything else? That's it, right? That's the spectrum of the things they're saying, that they're trying to scare you, that there are 3-4 kinds of letters and you need to know each. We have learned during this whole session, during this whole course of around 10 days, 10 to 12 days, that there is no such thing as transfer letter, there is no such thing as discharge letter, there is a thing as urgent referral and emergency referral, there is a thing as update, there is a thing as information, right? But then again, essentially all the letters are what? All of the letters are referral letters, right? All the letters in itself are referral letters. All of them are referral letters, okay? So that is very, very important. Then we learned was that, a letter, depending on the situation, right, of the patient, where the patient's vitality of organs or himself is a threat, right, then that is called an emergency letter. Do you all agree? Because we've done this, right? I'm just revising, right?
Yes.
Right, that is an emergency. Okay, now I've told you that what does it mean by transfer? Dr. Deepa, if you're there, could you tell me what does it mean by transfer? Or Dr. Amber, could you tell me what does it mean by transfer? What does it mean by a transfer letter?
Transferring is sending patient from one hospital setting another hospital setting.
Right, one hospital or one facility. Let's call it a facility, right? Like let's not limit ourselves. Okay, so what I'm trying to give you is a broad understanding. All right, broad understanding of any kind of letter that might come your way, right? So that is a transfer. Okay, now we did a letter where a GP, where the person had already been in the facility before, but he was going again. So that just makes you think like that, they already know him. So that kind of became again kind of a discharge, right? Now, the thing is, the essentiality for a transfer is that the patient should be admitted from one place, going to be admitted in another place. That is a transfer. Okay, discharge is that the patient was admitted, but now he's going back home. Maybe he's going back to some other doctor. Maybe he's going back to his old GP. All right, now, they can say anything depending on what the case notes say. This is why I tell you, do not decide by just reading the task what kind of letter it is. Okay, do not just by reciting or reading the task know what kind of letter it is, right? You have to read the whole letter for you to understand whether it's an urgent, emergent letter, whether it's a simple referral letter, then whether it's a transfer letter, right? Whether it's a discharge letter. And if it is a discharge letter, does the GP already know him, or it's a new GP? Or even if it's a discharge letter, and if the specialist knows him already, or the specialist is new for him. Right now, there are many situations that can happen. Now, you guys also said an update. What would that be? That would be update the person. Now, whom do you update? You update someone you already know, right? So if I'm updating you, Dr. Fasi, Dr. Zishan, Dr. Moaz, or Dr. Rabia, if you guys are still here, I'm just updating you because I already know you, right, guys? So I hope these terms are clear, and that for Next time, if any of your friends, inshallah, when you pass and any of your friends ask, what is a transfer letter? You tell them that, all letters are referral letters. They could be emergency and urgent. But transfer just means when a person is admitted in one facility and then they go to another facility. Everybody's clear about these things? Any questions at all?
Yes.
Any question? Because I want to make sure that you can write any kind of letter that comes your way. All right, my candidates, whomsoever they be, may they be in small number, I just want to make sure
Can you
that
please
you guys understand that.
update letter?
What? Sorry, update?
Read about update letters.
Okay, Dr. Amber, do you know me? Who am I?
Yeah.
Who am I?
You are Dr. Hafsa.
Okay, good. So if you know me and you tell me that, I'm Dr. Amber and I've been with you for 3 or 5 days, and you know that I've been studying for so long, and I just want to update you on my progress. What does that mean?
That you have known my progress previously.
That you know me already. And I would just tell you what happened to me, of the things that I don't know. For example, let's say there is a patient named John. Okay, that's the most common name when it comes to you learning anything, be it USMLE, OETs, etc., whatever. And there's a Dr. X. Okay, Dr. X is John's GP. All right. Now he follows up on Dr. X all the time. But now what the thing is that John has got schizophrenia. All right, are you following me, guys? John has got schizophrenia, and it has been so that John is not following up with his GP. And what happens is that he starts abusing cocaine. All right, starts abusing cocaine. What would happen to John? His schizophrenia would go bad, right? It would go really, really bad, and he might end up in the hospital. Okay. Now, if you work in that emergency, or let's say psychiatry, okay, right? Does this GP know about John, that he ended up in the hospital, he started abusing a cocaine, and now he's in the emergency? Does this GP know, unless this doctor emergency or psychiatry staff tells the GP?
No.
Would he know that? No, right? So now what you're doing, you're updating them of something that happened to this person while they were at another facility. As simple as that. Okay. Now here could be another thing, that this should not just be GP, this could be a surgeon. And they had treated him for, let's say, a bariatric surgery before. Okay, they went through a surgery, and John went through a surgery and things were fine. But now his GP says that, John is started experiencing hallucinations because of something. So what you're doing is you're sending him to the same doctor who had treated him earlier, but now you're sending him. Why? Because there is a change in the situation and you're updating him. Is that clear, Dr. Amber?
All right. So it's a kind of discharge, but update.
But you see,
To an
discharge
OT.
means discharge. See, now when you say discharge, right, it means that the patient was admitted. Okay. For example, you're sending a patient who regularly follows a psychiatrist. Okay. Or let's say you're sending a patient, as one diabetologist, okay, is sending the patient to their regular endocrinologist. Are they different people with different professions? Yeah. Endocrinologist is a different person, and a diabetologist is a different person. Now both of them are following John, right? They take care of John. Now John has got like now endocrinologist is writing to his regular diabetologist that John has got a foot gangrene. Okay. So and they both just follow them up on the clinic. Okay, are you following me, Dr. Amber? Does it make any sense? They
Yes.
both follow him up on the clinic. Now, when this endocrinologist sends John to diabetologist, would that be a discharge? Even the diabetologist knows John?
Be a transfer letter.
No, but he's not going to stay in the admit. He's not going to be admitted. He's not going to be admitted in the setting, right? Is he going to be admitted in the setting? When you transfer means admit them. This is going to be an update, isn't it?
Right.
This is why I'm saying confuse yourself with the terms. You could just simply write down, I'm writing to refer. If in the task it says update, you'd say I'm writing to update. And then if it says inform, that's almost the same thing. They're just trying to confuse you. What I'm trying to tell you here is focus on three things: who the patient, whom are we sending to, right? GP or whatever the person's profession is. Then you have to see, is this person already aware of them? A GP would be, right? If they say regular surgeon, right, that means that person would be aware of him. Okay, if they say that now they're going for a surgery, they're not a regular surgeon of this person, then it means it's a new person, it's a new case, and you have to write everything. Do you understand, Dr. Number?
Yes. Thank you.
Have I confused you? Have I confused you in any way?
No, you didn't.
Are you sure? Because your no you didn't doesn't sound very
No, I got it.
Are you sure 100%?
Yeah, you can ask questions.
No, I'm just saying your voice doesn't seem like that, because I can only assess via voice. This is why. Okay.
All right.
Okay, good. Okay, now, all right, guys, any questions? Because we're gonna do something today, and you guys, we write in an introduction for me. So we're gonna do the last kind of bit of write-in letters. Okay, guys, everybody clear about this? If you have any questions, Dr. Amber, that's good that you ask questions, and you help us all understand more. Yeah. Okay. All right. This is task 31. Okay, task 31 on page number 36. Task 31 on page number 36. You guys have 5 minutes to read this letter and 4 minutes to write the introduction. All right, 5 minutes to read it and 4 minutes to write the intro. My writing is ridiculous, but I hope you guys understand. Everybody clear on the task? Read the letter and in 4 minutes write the introduction. And I'm keeping a timer. So that means that, your time's very limited. Okay. No time would be given. Anybody who goes beyond the time, their letter would not be checked, even after the class. Okay. So be very careful. Your time starts now. All right. This is via Dr. Fasi, right? Dr. Moaz. Dr. Moaz, can you read this if you're there?
Yes, madam. I'm writing to update you about Mr. Haywood, a 23-year-old who is diagnosed with deep vein thrombosis for future management.
Okay. Tell me one thing. What kind of letter is it?
It's a letter in which we will update his regular GP about his ongoing situation.
Okay. Who is diagnosed with deep venous thrombosis for future management. Can you read this introduction again for me? Dr. Moaz, just one more time. Please read it.
Yes, I'm writing to update you about Mr. Haywood, a 23-year-old university student who is diagnosed with deep
Where
vein
is university student? I don't see
I
university
forgot to
student.
write it.
Okay. All right. Who is diagnosed with deep vein thrombosis for future management? Does it look incomplete? Does it look incomplete?
A little.
Okay. All right. We're gonna talk. We're gonna talk. Okay. After dear Dr. Karens, please put a comma. Don't forget that. All right.
Okay.
Please put a comma. The rest of it is fine. No, it's still not fine. Why have you written the address like that? Were you short on space or deliberately?
There was no comma.
There was no comma. First, let's talk about that. Okay. Let's see if that's really true. Now, see? Dr. Sue Karens, 29 Rice Street, full stop, Fitzroy, North Melbourne, 3068. Still, it's like a street thingy, so you have to write 29 Rice Street separately. Fitzroy North Melbourne, you can write separately, okay? Because there is definitely a dot, okay? Okay, all right, okay, all right. Okay, all right, that's good. And so you're saying that this is a letter where you are just updating. Dr. Zahra, can you read this? Can you read yours?
I'm writing to update me about Mr. Haywood, whose features are suggestive of deep vein thrombosis your further management would be greatly appreciated.
Okay. Look at your W in whose, okay, and look at your W in Haywood. Can you see that? That is a small w, that is a capital W. They're going to think that you're using capitalization, so be very aware of this.
Yeah,
Okay.
ma'am.
I mean, minor mistakes. They just want to find out a way to not, not crowd the area where you're trying to go. Okay.
Yes, ma'am.
Okay. All right. Dr. Rabia, can you read this for me if you're there, Dr. Rabia?
I'm writing to refer Mr. Taylor, 38 years old, gardener, who presented with most probably injury of medial cartilage. Your intervention to remove damaged cartilage in order to prevent further osteoporosis would be highly appreciated.
Okay, this is a good introduction, but this is of an entirely different letter. But this is good introduction, all right, Dr. Rabia, just for that. Okay. Apart from that, you're going to write a 38-year-old gardener. Okay, just stay tuned. If you have any questions, we're here. Okay.
Okay,
All right,
thank
Dr.
you.
Rabia. Okay,
Thank
this
you.
is a good effort, by the way. No worries, no worries. Okay, Dr. Umber, are you there? Can you please read this? Dr. Moss, do you see how Dr. Umber has written the introduction, the address? Do you see that?
Yes,
That's exactly how you do this. Okay. All right.
Okay.
Please, and Dr. Umber, I wouldn't recommend you writing date like this. I mean, use slashes, even though this is not inappropriate, but you use with pencil and you don't know when they get to check it. And it could be that the graphite rubs off, right? So use slashes so they know that, you use something. Okay.
All
All
right.
right. Okay. Please read this.
I'm writing to update you regarding Mr. Haywood. I just forgot to mention the age. So a
That's all right.
23-year-old, a 23-year-old man whose
You
features
can
are
read a bit
suggestive,
about, so that's okay. Please go ahead. Yes.
of persistent soleal thrombus. For further assessment and management regarding fragment injection and adjustment of dosage of aspirin.
That is it. That is all you're sending him for. You don't want him to follow them up. You don't want them to, like do the rest of the management, etc., etc. Because you're
I
very
wrote,
specific.
I wrote for further management, assessment and management.
Assessment management, full stop. That is it. Because if you write exactly this, and they'll be like, okay, I don't have to check his blood pressure. I don't have to keep update of anything else, right? I'm just telling you that. I know it's stupid, but if you write like that, it would just be that it would show that you just want them to take care of only this thing, isn't it? Doesn't that seem like that? Okay. First of all, your introduction is very, very good. Now, here's something that you've done that nobody else has done. I'm writing to update you regarding Mr. Hayward. Now, whenever you say about, right? About, do you guys remember that that's very informal? Instead of saying about, how about we say regarding? About is kind of in the speech form, right? Say regarding. I'm writing to update you regarding. Okay, that is more formal. So this is why it's better to say regarding. All right, guys. So all of you almost have done this, right? See, update you about, not about, regarding. Regarding is far better. I mean, it's not incorrect, but it's better to say regarding. Okay, is that clear, guys? This is going to be an easy one. Okay, let's just read this one.
So you are trying to say, should I limit this till for further assessment and management? I should not write. I should not
Don't
write
limit it.
about.
Actually, yes, Dr. Amber, I'm sorry to cut you off. See, don't limit this. You've limited it, right? So, for example, you are a GP, and I say that, I just want you to manage him for fragment. I didn't say just, but I'm saying I want you to manage him for fragment. So it'd be like, that is the only work you want me to do. There must be so many things else that you want me to do, right?
Can
So
we
don't limit yourself.
can we use something different than for further assessment and management? Because it sounds to me like this, that if we are a GP and we are sending someone to specialist, then it suits better for further assessment and management. Or can we say this for routine, for further routine checkup?
No, but you see, Why would you want to change it? Further management and assessment, that's what you do as a doctor all the day, every day. It could be in any country that you are. That's all you do, right? Whether you be the GP, the surgeon, or whatever, isn't it? Now you see, there is a thing that, this is what we do when we understand more about it. We want to change it. That's what I'm trying to teach you here, that please, if you remember something, if you know something for sure, stick to this till your exam day. All right? Okay. All right. Yes, Dr. Zishan, can you read yours? See, if you can
Yes, ma'am.
change that, Dr. Amber, and put it in a way that, that sounds grammatically correct, get it checked by me. And if you think that there is something that you can say and like it's approved by someone else, then you write it. Okay. Otherwise, don't put yourself in trouble. All right. By the way, it's a good question. I like when you ask questions. All right. Okay, Dr. Zishan, please read yours.
I'm
First of all,
writing to
look at your
update.
address. What would you do differently in the address? Just write 3068 downwards, all right?
Another
Just below
line. Okay.
in the other line.
Okay.
Okay, please read it. Please read it.
I'm writing to update E missing
Good,
about
good.
your patient.
Your patient,
About
okay.
your patient, Mr. Haywood, a 23-year-old male who has been diagnosed with deep vein thrombosis, and he requires your assistance in ongoing in his treatment.
What is incorrect here?
And he requires your assistance in.
In his ongoing care, would that be okay?
Yes.
Okay, so you see, by now you guys know what are your mistakes. That is good. Now, my first question is that if I don't say he's your patient, would he not be his patient anymore? If I just say I'm writing to update you about or regarding Mr. Haywood, does he cease to be his patient? No, but you save your words. Isn't it? Right, Dr. Zishan? Dr. Zishan, can you hear me?
Yes, ma'am. Yes, ma'am.
I'm saying that when you don't use the word your patient, right? You've written here, I'm writing to update you regarding your patient. Does he cease
Yes.
to be his patient? He doesn't cease to be his patient. He's still their patient, but you save some words. So anywhere where you can find to save words, save those words. Dr. Fassi, you've written it very late, but because it was almost within time, so I'm going to read it. Dr. Fassi, can you read it for me, please?
I am writing to update you regarding this is Mr. Haywood, a 23-year-old university student whose features are suggestive of deep vein thrombosis. Your further care and assessment would be highly appreciated.
Very good, very good. Good. Now, here is the thing. Look at your dates, Dr. Fassi. 230108, 23585. What is incorrect? Double digits, right? In the first one, you've written double digits. In the second one here, you've not written a double digit. There should be a consistency in the date. Okay? All right? Okay. All right. Now, here's the thing. I'm writing to update you regarding Mr. Karen? No, Mr. Haywood. That's the patient's name. A 23-year-old university student. Now, wouldn't he know that he's a university student? It's better to say I'm writing to update you regarding Mr. Haywood. All right. Or better yet, as anybody else said, that I'm writing to update you regarding your patient, Mr. Haywood. Okay, that's also good. But try and reduce the word count. You would just say I'm writing to update you regarding Mr. Haywood. That's it. Because when you say update, that means he already knows him. Okay, so this is very good. You all have written very good introductions. You guys have learned, mashallah, a lot. You have written very good introductions. All right, let's move to it. Any questions, guys? I hope not, because we're moving on. Okay, advise patient to cease fragment injections, take half an aspirin daily, flight to Melbourne early February, okay, elastics, and exercise during flight recommended, fragment injection prescribed to be given pre and post flight, regular GP to be contacted before ceasing daily aspirin dosage. Why we read it? Because we just want to see the patient stable, right, guys? I know I'm going fast, but because you have to pick up. Okay. Now this is the first visit, right? After you've read the plan and the assessment, you read the visits, right? So this is the first visit. Okay. This is a second visit. This is a third visit. 3 visits are there. Okay. So Dr. Zishan. Dr. Zishan, are you there?
Yes, ma'am.
Can you please read this for me?
Okay, ma'am.
Can you read this?
John Haywood, date of birth 23/05/85, on holidays after overseas trip, staying with his parents in Brisbane for several weeks before returning to Melbourne, his normal residence. You are his parents' regular GP. He has experienced pains in his right cuff since arriving from UK 4 days ago. Stair's pain has become increasingly severe and his cuff is tender to touch.
Good. Now tell me what's happening. Tell me what's
He
happening in
just
this letter.
returned from a overseas trip and he's staying with his parents right now in Brisbane. Basically, he's studying in Melbourne. So he just visit to the regular GP of his parents. So he just told him about his signs and symptoms, and that's it.
That's good. Any information that you want to exclude? Is there any information here which is irrelevant in this paragraph only?
Staying with his parents in Brisbane.
Guys, anything irrelevant here? Anybody at all can find anything irrelevant here? Because I'm just asking questions now, because we're done with teaching you. Right now, we're just asking questions.
Everything
right?
is relevant, I think.
Okay. Yeah, that's right. Everything is almost relevant, except that you would not say that he was on holidays after overseas trip, because the GP already knows. Right, the GP already knows. What he doesn't know is that, he had started to experience calf pain. Like when you go for a foreign trip in other countries, you inform your GPs and all. You might take some shots because, in different countries, there are different pandemics and endemics. So you have to take shots, right, from your regular GP. You have to get appointments to be safe for flight. Okay. In other countries that happens. I'm not sure if it happens in Pakistan. I don't think it does. So in other countries that happens. So he might know, the GP might know, because, we're writing a letter to whom? We're writing a letter to whom? As you read over here,
regular
it
GP.
says we're writing a letter to his regular GP, meaning that regular GP knows that he's going for a flight, okay? But he doesn't know that, he started experiencing calf pain, and 4 days ago since he arrived in the UK, and he's becoming increasingly, his calf is becoming tender to touch. Okay, now let's read it. Okay, Dr. Fasi, sorry, Dr. Moaz, can you read this?
On 7th January 2008, single Monash University student studying commerce.
What does that mean?
Means
Dr.
he's single
Deepak,
and is
Dr. Zahra, what does it mean?
Ma'am, he is single, unmarried, and he is a student in Monash University, and he's studying commerce.
So he's unmarried, or he means that he's just once got admitted and has once just studied in Monash University?
No, I think he's unmarried.
Don't just say you think, you say I believe.
I believe,
right?
yeah. But I
Okay.
I thought that I would just write in the letter that I believe.
Yeah, you believe, you don't think. Even when you're going to do speaking, right? You're going to take OET speaking. So, you can learn from that. You would say, I believe, instead of saying, I think. Okay. Because thinking doesn't make you professional. Because, when you say, I think, you sound a little unsure. When you say, I believe, even though it's the same thing, it's more of a professional thing. Yeah. It's more like, Okay. So, yes, Dr. Moss, please go ahead, read it.
Smokes 8 to 10 cigarettes a day. Social drinker, 4 to 6 small beers, mainly at the weekend. Plays squash and walks regularly. Currently not on any medication, no known allergies.
Okay. All right. Tell me what is relevant, what is irrelevant, what is semi-relevant. What would you write in your letter out of this? Yes, Dr.
About his smoking, we will write it. Everything else the GP already knows, so we don't write it. We can skip it.
Dr. Amber, what do you think? Yes, Dr. Amber, what do you think?
I believe that GP already knows his social history and past medical history as well. So there's no need to mention it, though we can write it as a as as to remind him.
Okay. All right, Dr. Rabia, what do you think?
I think we will write about his smoking and drinking habit and his
Okay. All right.
sports activity, and we will
Mhm.
not mention about allergy and medication. These are negative.
Okay. All right. Dr. Zahra, what do you think? Come on, guys. You know your name on the screen. Just say it. All right. Like, I don't need to ask. Yeah. Just take your turn. Yeah.
Ma'am, as we are sending him back to his GP, so he already know about his smoking habit and he's a drinker, unmarried.
Tell me what
So
you'd write.
nothing from this.
Okay. All right. Dr. Fasi, what do you think? Dr. Zishan, Dr. Fasi?
Ma'am, his regular GP know him already, so he know his past medical and social history. So no need to write that.
Okay. All right. Dr. Zishan? Yes, Dr. Zishan. I'm not moving ahead unless you guys tell me. I'm going to be staying here unless I see your names on the screen and you're not replying. I'm staying here. I got time.
Hello.
Yes, Dr. Zishan.
Ma'am, only smoking and social drinker. I don't think
Okay.
so.
You are
Anything
my
can
GP.
be
You
added.
are my GP. Dr. Zishan, you are my GP. You know me for past 15 years. You know that my father is a businessman. You know that he works in the police. You know that, he just got tired. I told you that my mom's, like a doctor. I told you that, I drink. I told you I smoke.
Yes, I know everything. I think no need to write anything
Nothing would be
from this.
written. All right. Nothing would be written. Okay. He already knows, because if you write it, you're wasting your time. Okay, you need to understand this. As in the previous case when we were doing psychiatry, we wrote nothing because the people already know him. They've seen him. Okay, all right, let's move ahead. Let's move ahead. That's just important. That's why I made you read it. Okay, BP 120, 70, pulse is 74, cardiovascular respiratory examination normal. There was tenderness and swelling in his right calf. Suspected deep venous thrombosis, sent to Queensland X-ray for ultrasound. What does this mean? Dr. Zahra, what does it mean?
Ma'am, he was sent to the Queensland X-ray department for ultrasound.
That doesn't mean that he needs an X-ray and an ultrasound. That doesn't mean that, right?
Yes,
That's the
ma'am.
name of the
They
place.
already sent. They already sent to Queensland X-ray for ultrasound.
Yeah, that means that this is the name of the place, right? Many of your friends and colleagues, like I've been teaching for the past 3 years, what they do is they write this as well. Okay, so that's not supposed to be confused, okay? All right, schedule an appointment on 803 to review the results. Review the results of what, Dr. Fasi?
Ma'am, ultrasound.
Of ultrasound. Good, good, good. Okay. Results came back 4 centimeter thrombus in soleal vein. That's the next visit, the second visit. 16 centimeter blow in the increase in right calf. Explain diagnosis and treatment to John. This is the action for whom? Whom is this action for? Just say it without, like I don't want to take names. Just say it. Yeah.
For
Doctor.
Mr. Haywood.
Mr. Haywood. But who is going to do this? The current GP?
Dr. Karen's.
No,
Current
ma'am.
The
current
parents.
doctor.
The parents doctor, right? The parents doctor, not the current doctor. Current doctor is his doctor. Parents doctor is his parents doctor. Okay, we're going to talk like that. Explain the diagnosis and treatment to John. Provide literature on stop smoking. Initiate prescribed Clexin, 40 milligram and 0.4 ml injections twice daily for 3 weeks. Arrange for nurse practitioner at your clinic to teach John how to self-inject. Okay. Advise John to avoid further flights for at least 4 to 6 weeks, depending on response to Clexin. So one visit is here, and we're about to end this because it's kind of simple, and I'm sure you guys would be able to understand it in a simple way. Now, my question is, okay, these are 4 visits. Sorry, there are 4 visits. I see. If I don't mark them, I don't know them, right? So 4 visits. When you're going to do your letter, you have to mark them like this, right? I'm doing, okay? Okay. Dr. Yes, Dr. Dr. Umber, can you just read this for me? The one that I just read. Can you read this paragraph?
Action.
Mhm. Yeah, this just is. Tell me,
Explain
what would you
diagnosis.
not write? No, just tell me, what would you not write in this? What is irrelevant or what is semi-relevant? Just read this and tell me, what is semi-relevant
What is semi-relevant?
or irrelevant?
Arrange for nurse practitioner at your clinic to teach John how to self-inject.
That is irrelevant, semi-relevant.
Semi-relevant. It is
Dr. Moaz,
irrelevant.
what do you think? Okay, Dr. Moaz, what do you think? Quickly, open your mics and reply. Relevant, semi-relevant.
Semi-relevant.
Semi-relevant. Dr. Umber, you just said
Irrelevant.
that. Dr. Rabia,
I think so, semi-relevant.
Doctor, do you know what semi-relevant means? Do watch the course, okay? Don't worry about it. Don't worry about it. Dr. Zahra, what are we going to do? Dr. Fasi, Dr. Zahra. Go ahead. Tell me.
Ma'am, provide literature on
Ma'am, we should write
stopping.
click.
I think I believe that we will not write arrange for the nurse practitioner at your clinic to teach John how to self-inject and explain diagnosis and treatment to John.
What else? Yes, Dr. Zishan, what were you saying?
Ma'am, Clexane should be written stop smoking and avoid further flights for at least 4 to 6 weeks.
And what about the stop smoking initiative literature?
We can write it in one line, like educated on stop on smoking cessation and self-injection.
Okay, all right. Let me read the next one, then you're going to write stuff for me, okay? Okay, I'm not telling you whether what is true or not. I just want to see what you know. Okay, so John comes to your surgery to report what he thinks is an allergic reaction to the injection. Advises he has succeeded in reducing a cigarette to 2 a day. BP 120, 75, pulse 74, regular, cardiovascular, respiratory is normal, red rash and bruising and welts around the injection site. Change prescription from Flexen to Fregmin and prescribe soothing cream for rash. Arrange appointment for ultrasound to monitor progress. Now, what I want you to do is, you guys have 8 minutes, which is a lot if you ask me. 8 minutes for you to write his first 3 visits. If you want to write the social history, go ahead, it's your choice. You guys have 8 minutes to write his first 3 visits. 8 minutes to write the first 3 visits. Trust me, it's not much. It's 12:06 on my clock. So let me just start doing my math, which I'm bad at. How much would it be? It would be, let's say I'll be coming back on 12. I'm bad at maths. All right, 12:12. Okay. All right. Okay. Sorry, 12:14. Okay, that's your limit. 12:14 p.m. Sorry, a.m. Your time started. See, I'm blabbering. This means you should not be listening to me. You should start writing. Okay, 8 minutes, the first 3 visits, your time starts now. Okay, good. Right. Yes, Dr. Zishan, can you read yours for me?
Initially, Mr. Haywood presented with the complaint of pain in his right cuff for 4 days after arriving from UK.
Please, can you say that again? Please, one more time.
Initially, Mr. Haywood presented with the complaint of pain in his right cuff for 4 days after arriving from UK.
No, cough. Pain in his right cuff. Okay? The
Yes.
accent does not matter in your speaking. Inshallah, you're going to take your exam too, right? I got to know your exams on the 19th. So the accent does not matter, but the pronunciation matters. It's cough, not cough. Okay?
Cough.
All right? You are talking like a Turkish person. Okay? They also pronounce it as a cough. Okay? Don't worry. Go ahead, please. Yes.
On examination, there was tenderness and swelling in his right cuff. He was ordered an ultrasound with the suspicion of deep vein thrombosis. His ultrasound report showed 4 centimeter thrombus in soleal vein. Therefore, he was commenced on injection Clexane 0.4 ml twice a day for 3 weeks.
Mhm.
Additionally, he was advised to avoid further flights for at least 4 to 6 weeks.
Mhm. Okay. All right, good. You're saying initially Mr. Hayward presented with a complaint of pain in his right calf, right? Just look at the C of calf. It is too big for us to compare it with your complaint, isn't it? Look at the innocent C of your complaint and the dangerous C of your calf, okay? Make it same,
Okay.
all right? All right,
Okay.
after arriving from UK, okay? On examination, there was tenderness and swelling and a swelling because you're mentioning the swelling for the first time, right? So and a swelling, remember when we use a when we're using the thing, we're mentioning it for the first time, right? There was a tenderness and a swelling, all right, in his right calf. He was
Okay.
ordered. Now he was ordered. No, he was not ordered. He did not do his ultrasound himself. You would say the ultrasound specialist was ordered, or I was ordered to perform an ultrasound, meaning you were performing the ultrasound. Somebody ordered you. We didn't order him to perform his own ultrasound. No,
Okay.
you would say an ultrasound was ordered, or you could say directly that ultrasound revealed a deep venous thrombosis, right? Or you could say a suspicion of deep venous thrombosis was made, confirmed by the ultrasound, as it showed 4 centimeters so thrombus in soleal vein. Now it becomes a big
Ma'am, we
story.
can
How?
write directly that
Yes,
ultrasound
yes.
report showed.
Yes. Don't
Okay.
waste your time. They don't need to know this story. They don't need to
Okay.
know. Okay, I called the radiology department. Mr. X picked up the phone. I told him you have to make an ultrasound. He said, all right. Then I told him it's going to be off his right calf. Then he says, okay. And then after 4 days of wait, the patient came in. He gave me the file. After the file he gave me, I saw the report. I just opened up the light in the radiology kind of thing, and I found out, oh my God, that there is a thrombus in his soleal vein. Right? You don't need to tell him the story. He doesn't need the story.
Okay.
He needs facts. All right. Therefore,
So we
he was.
can skip the whole sentence like he
Yes,
was ordered and
yes,
okay.
yes. Because it just wastes your time, doesn't it? Just directly
Okay.
say what appeared. They don't have time to know. Okay, ultrasound was ordered. Yes, it was ordered. Okay, skip the obvious. Please write it down, guys. Skip the obvious. All right, skip the obvious. I need to go to the UK. I would need a visa. That is very obvious. Without that, they won't let you in. They'll be like, please go back home. Where's your visa? Right? Okay, so
Okay.
therefore he was commenced on injection Clexane twice a day for 3 weeks. Additionally, he was advised to avoid further flights for at least 4 to 6 weeks. This is very good. Let's move on. Very nice. Good, Dr. Zishan. Really appreciate it. Okay.
Thank
Okay, all right. This is Dr. Rabia. Dr. Rabia, initially on this date, first of all, I must comment, say that it is very appreciable that you've just started with us and you are on the last day of your session and you're writing it. This is very commendable, right? It takes guts. So that's very good. All right, Dr. Rabia, are you there?
Yes, ma'am.
Can you
Thank
hear
you.
me?
Yes, ma'am.
Okay, that's very good. Okay, initially on this date, okay, now you see, I've told them that, like, don't write initially and on this date together. Either one of them, either write initially or write the date, because otherwise it's
Okay.
just waste your word, okay?
Okay.
And the date is equal to one word. If you're writing the date in numbers, as you've done it here, it's equal to one word. But if you write the date in number and word, as in 08 January, then it becomes 3 words, all right? Mr.
Okay.
Hayward presented with the complaint of tenderness. Tenderness T should be small, and swelling in his right calf. In
Okay.
his right calf. A complaint with the complaint or a complaint, because a complaint is the first time. So, but you have written about the complaint initially, maybe in your introduction, so you can write it here. But anytime you write the thing for the first time, the tenderness has been mentioned first time, swelling has been mentioned first time, use a. He was advised for, okay, for's F should be small to rule out deep vein thrombosis. Deep veins D should be small, thrombus T should be small. You're going to learn it through the grammar sessions that we've done. Okay, all right.
Okay.
That these should be small. Subsequently, on this date, Mr. Hayward, after Mr. Please put a dot as you've done in your first paragraph, presented with ultrasound report of 4 centimeters thrombus in soleal vein and 6 centimeter below knee in right calf. One thing you've done good is that you've written that how below it is, because then the doctor knows where it is. You've written it specifically, which is good. He was advised to quit smoking and avoid flights for 4 to 6 weeks, and he was prescribed Clexane injections. Name should be written completely, and it should not be written with a capital I. With a capital I.
Okay.
All
Okay.
right. It should be written with a small I. All right. It should be written with a small I. Okay, it should be written with a small I. Okay, and he was prescribed Clexane and all of this. Now the thing is, the order of the things here is incorrect. First, should be writing his sign and symptoms or whatever he had, all right, or whatever the report was, right? Like the order of the things is a sign and symptoms, examination, right? I'm just revising it for you guys, right? All of you.
Okay.
Sign and symptoms, examination, then the results of the examination, then the investigation, the result of the investigation, the diagnosis, then the treatment, right? And at the end, advice. So the advice of quitting smoking and all should be coming at the very end, okay?
Okay.
Unfortunately, on this date, Mr. Hayward came to report his allergic reaction to Clexane. On examination, there was bruise and red rash. Okay, this is good. The effort is really good, but you need to learn the basics of it, for which you'd have to watch the whole thing. All right, Dr. Rabia? But this is
Okay.
very good. This is the
Thank
first
you.
time you're writing a letter?
Yes, ma'am.
So you've never written a letter before, ever?
No,
You're really serious about it? Are you sure?
I had seen your video. Your
Okay, but you've
video
never
that
written a
was
letter.
no.
Watching a video is another thing, but you've never written a letter. Okay, this is very, very nice. Okay, this is very good. Okay, keep going. All right. Okay, this is very good.
Thank
For
you.
the first time you're writing a letter, what do you guys think? Because you can be teaching your friends one day, inshallah. You can teach your friends as you move along, huh? Pass it on.
I mean, it's a
Yes.
great effort.
Yeah, isn't it? She's written really nice, isn't it?
Oh,
Yes,
Yeah,
ma'am.
she's written really good.
Very well.
Very good. Very nice, very nice. All
Thanks
right,
a
that's
lot.
very good. Thank you, Dr. Rabia. Okay, so this is Dr. Fasi. Dr. Fasi, you want to read your letter for me?
Yes, ma'am.
Okay, go ahead.
On January 2008, Mr. Haywood presented with complaints of swelling in his right calf, which was tender on examination. An ultrasound was appointed in a day for confirming deep vein thrombosis. The ultrasound showed 4 centimeter thrombus and soleal vein, 16 centimeter below knee crease in right calf. Consequently, he was advised regarding quitting smoking and he was commenced on 40 milligram injection.
Okay. Can you hear me? Can you hear me? Okay. Please reread it and tell me your mistakes from the first sentence.
Ma'am, presented with a complaint or the complaint.
A complaint
I
or the
should
complaint?
write
A
that.
complaint. All right. A complaint. Okay. What else?
Yeah.
Okay. Okay. Please go ahead. Read it. You guys know the things by now. Okay. An ultrasound was appointed
Yes,
in
ma'am.
a day. Should you write that in a day? Does it make any
Ma'am,
difference?
yes, ma'am.
Yes or no? That doesn't make a difference. If you order it in a day, right now, immediately, we don't care. We just want the results, right? We're selfish like that, isn't it? Okay. The ultrasound, I hope you can hear me because your voice is breaking out. The ultrasounds you should be small. Showed. Instead of saying showed, guys, you can say revealed, depicted, demonstrated, figurized. Like you can come up with many words. 4 centimeter thrombus in soleal, in the soleal, because also soleal is a structure in the soleal vein below the right knee crease. Okay, crease is, I don't know what you've written. I mean, I'm just
Ma'am,
guessing it, but Mhm.
like that's what written in the case note.
Yes, but tell me, what is this? What does this look like? It looks like a U. It
No,
looks like a R.
no,
It
ma'am.
looks
I'm
like a
talking
A.
about. No, ma'am.
Mhm.
I'm talking about the soleal vein or the knee crease.
Okay, that's good. But the crease doesn't look like a crease.
No,
You've
ma'am.
written something else. Mhm.
I'm talking about below the knee
Yeah,
crease.
that's good.
So
But CRESE, it doesn't look like that. That's what I'm trying to say.
no, ma'am. I'm talking like there was no D written in the case note before knee crease.
But you have
So
to. You have to write it. They
yes.
wouldn't write it, right? Because those are the nurses or somebody else. They're just making notes. You have to write the letter in the right
Okay,
knee,
ma'am.
below the right knee, right? Because it's a specific, or you could say the ultrasound showed 4 centimeter thrombus in the soleal vein below the knee crease of the right calf. All right,
Okay, ma'am.
of the
Okay,
or
ma'am.
in the right calf, in the, because we're being specific. All right, the makes it specific. Have you guys noticed that they don't say the Pakistan, they don't say the India, they say the UK? Because why? Do you guys know why? Because UK or they say the United Kingdom. They don't say the USA or the America. Have you guys ever noticed that? Why is that? Do you know why? Because almost all
No.
the English, because almost all the English was created by them. They ruled worlds. They are a very small island, but they're very, 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 very sharp and intelligent in a way that they have made us think that, you know, they are the best, and they are, because they made themselves prioritize by using the word the. All right. If you
Yes,
become
ma'am.
a brand, right, one day, inshallah, if some of you become a big doctor, right, they'll not just say he's a cardiologist, he'll say he's the best cardiologist or he's the best surgeon, right? So if you want to make someone priority, if you want to make something specific, you use the. Have you guys seen
Okay.
that? Yeah,
Okay.
so
Yes.
just do that. Okay, I hope this makes you remember things that you wouldn't ever forget this, hopefully till your exam for sure. He was
Yes.
consequently advised regarding quitting smoking, and he was commenced on this much injection 3 times a day for 3 weeks. 1 week later, good, or you could say consequently, Mr. Haywood presented with symptoms of allergic reaction for injection Klexan, no, to the injection, right? What are you allergic to, Dr. Zishan? Are you allergic to anything?
No, ma'am.
Dr. Fasi, are you allergic to anything?
No, ma'am.
Okay, for example, if you're allergic to roses, what would you say?
I am allergic to roses.
To the roses, all right? Or I'm allergic to the roses, or you know, to when I see he developed a reaction to the roses. We don't use the rarely, but here we would use the, right? Okay, he remembered he developed an allergic reaction to, right? To
Okay.
Klexan, not for, to Klexan. Okay, is that clear? Therefore, Klexan was changed to Fragmin twice daily. This is good. You have not written about the smoking, right? Also, there is one more thing you haven't written about the follow-up, but this is good because you have read the whole letter and you understand that it's not to be written, or maybe you have forgotten it. Okay, let's see. Okay, Dr. Muaz, can you read this, please?
Yes, madam. Initially, Mr. Haywood presented with a progressive pain, tender right calf after traveling. On examination, there was tenderness and swelling. The features were suggestive of deep vein thrombosis, therefore an ultrasound was advised. A follow-up visit was planned a month later. Subsequently, the ultrasound demonstrated 4 centimeter thrombus in soleal vein of right calf. He was
Tell me your
commenced.
mistakes. Tell me your mistakes. Initially, Mr. Haywood presented with the progressive pain, tender, progressive pain, tender right calf. What does that mean?
There should be a comma.
After?
Pain.
Okay, progressive pain. Progressive pain, then comma,
Yes.
tender right calf after traveling. Okay. On examination, there was tenderness. Tenderness T should be small, and swelling. Okay. In the right calf, where was the tenderness and swelling? You did the examination of the what? You did the examination of the right knee. There was tenderness and swelling in the knee or the calf. It was swelling in the tenderness, and there was a tenderness and a swelling in the right calf. All right, don't skip words. Where you have to skip words, you guys don't skip words, but where you don't have to skip the words, you skip words. All right, Dr. Moss, is that clear? You're following, right?
Yes, ma'am.
The features, you've written good. I don't know why you guys get so down in just one comment. This is, you know, like it takes time to learn, and you've come a long, long way. I remember the first time you wrote your letters. Okay, I don't know if you remember. I remember. I still have your letters. All right. Okay, like in a good way. Okay. So what I'm trying to say here is be happy when the things are pointed out. Okay.
Okay.
Okay. Okay. What about suggestive? What is wrong with your word suggestive here?
S is bigger.
Yeah.
S
See, you know
is
your
capital,
mistakes.
so
You know your mistakes. All right. Suggestive of thrombosis
deep
or
vein
of
thrombosis.
a deep vein thrombosis, right? Of a deep vein thrombosis. The first time you're mentioning it. Therefore, an ultrasound was advised. Okay, a follow-up was planned a month later. Okay, so he's going to come after a month just to receive the
Yes,
results
he
of the
came after the
ultrasound?
month.
Tell
Yes, he
me
came
something.
after the month.
Tell me something. Tell me something. Tell me something. If he comes after a month, what is his condition, by the way? What is it? What is it that he has? You guys are doctors. Tell me what is it that he has?
He
What
has
is he having?
DVT, deep vein thrombosis.
DVT.
Yeah.
And if he comes after a month, do you think he'd survive or he would die? He can die of a heart attack.
Yes, he can die of a heart attack. He can have the CVA, but the note says he came after the month.
70108. 70108.
Okay,
Okay.
he came after
080108. A day
after
or a
a
month?
day. A day.
Okay. Okay. All right. Is that clear?
Yes, madam.
Okay. Be very careful about it. If you tell them that he came after a month, you did it yourself. See, this is not them. This is you. Okay. You're putting yourself in sabotage. All right. But that's okay. That's okay. After follow-up, please use dash. All right, Dr. Moss, is that clear? Subsequently,
Okay.
the ultrasound demonstrated a 4. Not just 4. I mean, why don't you want to give that a priority? A 4 centimeter thrombosis in the soleal vein of the right calf. Don't miss your articles. Anybody can write this letter, but what would give you marks if you write and follow the grammar rules? All right? Organize it, follow the rules,
Okay.
you're halfway there. Okay? Follow the rules. None of you follow the rules. He was commenced on Clexane injection twice daily. Additionally, what is wrong after additionally?
There's no comma.
Yeah, see, good. You know it. He was advised to avoid, or you could say he was
Traveling.
advised regarding,
Yes.
regarding traveling, okay, and educated. Okay, you've written educated. Okay. Additionally, he was, let's read it your way. Additionally, he was advised to avoid traveling and
Travel.
educated him regarding who educated him. He went to a school? No. Okay, so educated him regarding self-injection and smoking cessation. Now it's all jumbled up. How many times have you written "and" in this sentence?
2 times.
1, 2. How many times in a sentence you should write "and"? Whether it be a
Once.
complex sentence or not. Once. When can you write more than 2 or 3 times "and"?
When we are talking about 2 different group
2
of
or 4
things.
things? Yeah, groups of things. Are we talking about groups of things?
Kind of.
How? Traveling and education is a group of thing? Okay, what about injection and smoking? Are those group of things? Drinking and smoking go together because they're abusive habits, right? Education and degree can go together. Those are a group of things. They are not group of things here. Okay, meaning the category should be same. I've told you categories, sign and symptoms, that's a category. Examination is a category. Labs is a category. Treatment is a category, isn't it? Okay,
Yes.
are we clear or do we have some doubt?
We are clear.
Okay, good. Additionally, he was advised regarding traveling, avoidance of traveling, comma,
Avoidance.
commas, and smoking cessation. We don't care about self-injection. Self-injection of what? Do you want him to start abusing himself by self-injecting and then he can have infective endocarditis, he can end up in the hospital, then he'd say, I was a heroin addict? Is something like that going on because you're giving him suspicion that he was a heroin addict and he self-injected? Is that what the case is?
Okay. Got it.
No, did you follow? Did you follow?
Yes,
Okay.
yes.
All right, so you are not making him inject himself because you are asking him to use heroin. Okay. All right.
Okay.
Clear, Dr. Moaz?
Yes. Yes.
Okay. A week later, Mr. Haywood presented with allergic reaction around injection site. However, he was vitally stable. It was decided to change his. Good, very nice. What I like here is that you have not done one thing, which is you have not written what happens when one has an injection or allergic reaction. Obviously, you develop swells. Obviously, you develop bruises. No need to write that. So you did a very good job there. Okay, this is good. What is this? What is this? This word.
Which word?
This one. You tell me. What is this?
Yeah, fragment. I first wrote it with a small f, then
No. This
your
one. What is this?
review visit. There
There
should
is
be
no
a space
space.
between here.
There is no space, and it doesn't look like a review. It looks like a renew, maybe a reuse, something. Okay, be very careful about your spellings. If you think you can fool the examiner by, because I know you know this spelling, right? I know you know your spelling of review, but if you don't write it like that, they're going to cut your marks. I don't want that. Okay. I want you to pass this
Okay.
exam. All right. Be careful. Don't put yourself in trouble. See, all the things that you've done till now, all of you have made yourself. This is not a self-sabotage, right? Like you know the things, but you haven't followed those. All right. So be careful about it. Clear?
Clear, madam.
Okay. Any questions?
Not yet.
Sure thing. Good, good, good. Okay, Dr. Zahra, can you read this if
Yes,
you're
ma'am.
around?
Yes,
Okay,
ma'am.
go ahead. Mm-hmm.
Initially, Mr. Haywood had normal systemic examination. Sorry, ma'am, I just started from 07
No, no,
date.
no, please read it. Please read it. Please
Like
read it.
I
Please
had
read it. No
to,
sorries.
okay,
Okay, that's okay. Don't be scared. I'm not going to do anything. All right. I'm not coming to
okay.
Belgium. I'm not doing anything.
No,
Okay.
no, no. Okay.
Okay, go ahead. Don't
Initially,
worry.
Mr. Haywood had a normal systemic examination, except tenderness and swelling in the right calf. An
Good.
assessment of deep vein thrombosis was made. Therefore, he was sent for an ultrasound.
What is wrong
Um,
here?
um, Ma'am, I have to write swelling in the right calf
And and
and
and and and what? Do you have to start with examination? Did he come for
no, no, no,
examination?
no,
Right?
no, no,
Sign
no.
and symptoms.
Actually,
Okay.
yeah, I have to
Mm-hmm.
first write about his pain, but I didn't saw like
That's
above.
okay.
I
That's
just
okay.
started
That's
from
okay.
zero
You
seven
know
date.
why? You know why?
Yeah,
You know why? Because we're trying to be different, aren't we?
yeah, yes,
Now I've
ma'am.
told you, I'm not, see, let me just tell you, I don't know if you guys know, I've been teaching for the past 3 years. I've been teaching PLAB 1, I've been teaching PLAB 2. I'm also interviewing for USMLE. See, this is like, self praises, and they say in army, self praises are not recommended. So I'm not doing that. What I'm trying to tell you here is that if I tell you something, please believe it. I told you, you don't need to be different. You need to copy one another in order to write a letter so that you can get a 350 and be done with this exam and move on.
Mm-hmm.
All right. So don't
Yes,
invent
ma'am.
things. I know so many friends, so many students in the past, for the past 3 years, what they do is they invent new sentences on the very day of exam. You don't want to do that. All right. You don't want to do
Mm-hmm.
that. You don't want to invent things. You want to follow the things that you already know and just write them. Okay. Clear?
Okay, ma'am.
Everybody's clear? I don't want anyone to be confused here. Follow your friends, listen to one another. I have sent you so many things. We've done around let's say we've done 10, 6, 7 letters, and each of you are around 7 to 8 people. You've written 7 to 8 times each thing, so you have in collection of this drive around 40 or 30 letters each, right? 40 or 30 letters each, meaning different examples of how things can go wrong. Follow the things which are right. Listen to these recordings again. You've got time. All right, go for it. Why am I giving you recordings? Because I don't want you to make any mistakes in any letter that ever comes in your life for OET ever. Okay? All right?
Yes, ma'am. Yes,
Okay.
ma'am.
All right. On subsequent visit, comma, you've written a comma, but it is not very obvious, so make it very obvious. Mr.
Yes,
Haywood's
ma'am.
ultrasound report revealed, good, 4 centimeter thrombus in soleal vein and 60 minutes and 16 centimeter below knee crease in the right calf. What end? What end? You can say that the ultrasound report revealed a 4 centimeter thrombus in soleal vein below the right calf, below knee
Oh,
crease in the right calf. No end here. Okay. Mhm.
okay, ma'am. Okay.
He was convinced. Don't be sad. All right. Okay, you guys go sad and it makes me sad. All
No,
right,
no,
the
no.
voice should be always
I
good.
I was just
Okay.
rereading my
Okay.
lines, so
Okay.
just
All right. He was commenced on Clexane injections twice daily for 3 weeks. He was educated regarding self-injection, self-inject, no, self-injection, smoking cessation. Did you copy Dr. Moss?
no.
See, you guys have almost the same kind of thinking. I do too. So you know what? Learn from one another and know that we don't need to write about self-injection, because see, what difference would it make to the GP? The new GP, if he knows, oh my God, he knows how to self-inject now. What is he going to do about
Mhm.
it? He's be like, okay, fine, it's good for you. It doesn't help me. Okay, it's a good thing
Mhm.
for him, not for us. Okay, good for him.
Okay.
Yeah,
Yes,
is
mama.
it clear?
Yes,
All right,
ma'am.
Dr. Zahra, this is your last bit. You're saying on this date, Mr. Haywood reported an allergic reaction to the injection or examination. There were redness and all of this. You don't need to write that, because obviously
Okay.
allergic reaction is where you have welts and reds and red rash and bruises. You don't need to write that. Okay.
Okay,
Therefore,
ma'am.
you could just say that he had an allergic reaction to Clexane. Okay. What injection? Don't be suspicious. Write which injection it is. All right. Or you could just directly say Clexane. Because
Okay.
previously what happened was, why is this important? Because when this patient came to us, did he have any allergy? Dr. Fasi, did he have any allergy?
No, ma'am.
No allergy at all, right? No allergy at all. Now he's got allergy. The GP doesn't know. Now you need to tell him. Do you know what I'm
Okay,
trying to
ma'am.
teach you here? I'm trying to teach you here that you're updating a GP. You can update a surgeon, right? You
Mhm.
can update a psychologist. When do you update? You update a person who already knows them. He already knew them. He never knew that he was allergic to anything. The GP never knew. But now, if you guys forget to write that he's allergic to this and this, then if his GP refers this patient to someone else, what would happen? He would not be sure about fragment. Okay, that he's allergic to fragment. So we're writing that. All right. His prescription was changed from Clexane to fragment. Sorry, he's allergic to Clexane. Additionally, comma. See, your commas are very off the line. Dr. Zahra, they are hanging for help. They're looking for help. They're hanging by the thread. Please give them the thread. Okay, this is literally the depiction of hanging by the thread, isn't it? See, hanging by a thread.
Yes, ma'am.
Okay.
Sorry. Okay.
Additionally, a soothing cream for rash was prescribed. This is good. This is good that you've written what was done for the rash. Okay.
Yes,
All
ma'am.
right.
Okay.
Good. Good. Okay. This is a good letter, Dr. Zahra. You guys have all of you have
Thank
written
you,
good.
ma'am.
All right. All of you have written good. Dr. Amber, can you read yours for me, please?
Sure.
If you're there.
Initially, on 7 January 2008, he presented to clinic with complaint of pain in right calf.
What is incorrect? What is incorrect?
Mr. Haywood.
Okay, after that, what else is incorrect? You've written complains. Complain is a noun or a verb?
Now,
Okay. You, if you ever have to make tell someone about me, you would say, I have huge complaints about her, right? Complaints, it's a noun. Because you're going to say she is not on time. She never talks to her in a right way. She criticizes everything every time we write a letter. So those are number of things. Complaints is a noun. Complain is a verb. I want to make a complaint. Noun. Right? She is complaining of pain or she is complaining of pain, Dr. Amber?
she was complaining.
That is a verb because she's doing it right now. Please remember it like this. This is the only way you'd remember. I know when we were growing up, we hated grammar. I hated grammar. I still hate grammar. Okay. Do you hate grammar, Dr. Amber?
Yes, I do.
Be honest, all right? If you say you don't, then don't butter me up. I don't need that, all right? I got lots of butter at home, okay? You hate grammar, I hate grammar too. So she was complaining. That's a way of remembering it. She was complaining of pain, okay? If she's not complaining, you could just say complaint. What else is incorrect? You have not written Mr. Haywood. What else is incorrect?
I should have written either initially or date.
Okay, what else?
Pain in the right calf.
And what else? Here. Do you, if you don't write he came to the clinic, they would say, no, he came to the footpath.
So what should I else written it?
Don't write it. They know he came to your clinic.
Presented with complaint of. All right.
No. You're saying initially on this date, Mr. Haywood presented to clinic. He came to the clinic. That's obvious. Don't waste your words. And this is also incorrect. You're going to say he presented to the clinic. 3 words. If you don't write it, you could just say he presented with complaint of. Yeah.
Yes.
Because obviously he's coming to your clinic. He's coming to your hospital. Right? Don't write that. That wastes your word. I mean, if you want to write it, but I wouldn't recommend it. I mean, you're just wasting words. Okay.
All right. I got
All
it.
right, Dr. Amber. On examination, his right calf was tender and swollen. Good. Okay, swollen as well. Good. Okay.
Remainder of the examinations were unremarkable. Presumptive diagnosis of a deep vein thrombosis was made.
Okay. Give it a break. The remainder of examination was unremarkable, or you could just write the positive, leave out the negative. All right, because in the rest of the letter, the other thing never becomes negative, isn't it? Does it ever become negative? Does the CVS get abnormal? Does the respiratory system get abnormal? No, right? Just write the positive. Okay, let's not waste more time. All right, then you have written presumptive diagnosis. Presumptive were diagnosed. No, you would say a presumptive, right? A presumptive diagnosis. All right.
Of a deep vein thrombosis.
Yes, right. A presumptive. Were diagnosed
No, no.
No.
Were is of unremarkable. That was.
See, here you are. I'm here, and you are telling me that is incorrect. On your exam day, you're not going to be there. So your lecture shows them that I know this. So please be very careful. All right? Okay, Dr. Amber, this is a good letter. This is very good. The words are very good. I really like your word choice. But please be very careful about you writing the etc. etc. Okay?
All right.
Be very
So, should we
careful of
continue it?
articles. All of you have written articles incorrectly, all right? Like you have not even written articles. You all should write articles, all right? A presumptive diagnosis of deep venous thrombosis was made, and
Of.
was
Should it be of or deep vein thrombosis?
Yes. Good. You're pointing out your all mistakes. Good. Now, a presumptive diagnosis of a deep venous thrombosis was made, and he was advised ultrasound on subsequent visit of this date. Either write the date or write the initial or the thing. Or you see how many words are these? Let's count them. 1, 2, 3, 4, 5. 5 words. How about you just say subsequently? One word?
Subsequently, a day later.
No, don't say that. It's gonna be a day
So-
later. Well, it doesn't make a difference. If he comes after a day or so, you could just say subsequently.
All right.
Because what difference would it make? Would it make any difference to his diagnosis or his condition or his
No.
treatment if you don't write the date? No? Or just put the date. If you want to, just put the date on this date or on the date. Okay?
So,
Okay.
subsequently.
Or just write the date or write subsequently. Okay?
All right.
All right. 4 centimeter in the soleal vein, 60 meter below the knee in the right calf, for which he was commenced on injection Clexane, 40 milligram twice daily for 3 weeks. He was counseled counseled regarding smoking cessation and not to have any flight for at least 4 to 6 weeks. Not to have any flight, what does that mean? He is eating flights? Not to take a flight? Or yeah, that's good. Not to take a flight or not to get on a plane, right? But let's not write that because because when you write the letter, it turns out he came on a flight, isn't it? When you're writing a letter, when a GP is reading it, he's already there. Otherwise, how would we get the letter? Who brought him the letter? The patient did, right?
Yes.
Okay, all right. After a week, he presented with the complaint of allergic reaction to Clexane. This is good, but just please be very careful about the articles again, right? You'd say a week later or after a week, he complained of allergic reaction to Clexane. All right, the examination. Now, I know you have struggled to write on the examination is right. Please don't leave it without the article. Just say the examination. All right, no need to write the welts, etc. Okay. All right, Dr. Amber, is it clear? His vital signs were normal. Clexane was changed with fragment. Okay. And ultrasound was requested to monitor progress. All right.
I have a question. It should be Clexane was changed with fragment or Clexane was changed to fragment?
What do you think is correct?
I think with is fine.
Tell me. Yes, please tell me what is correct.
I just wrote with spontaneously, but I just read in someone's letter it was written to.
Okay, you tell me. I'm talking, all right? I changed Clexane with fragment. Is that incorrect? Guys, all of you, I changed Clexane with fragment. Is that incorrect? Yes or no? All of you, Dr. Moaz, is it incorrect? Dr. Fasi, is it incorrect? Dr. Zishan, is it incorrect?
No, ma'am.
I changed. It's not. Okay. It's not, or is it? Is it? Dr. Moaz, what do you think? Dr. Amber, what do you think? Dr. Zara, what do you think? How does it sound?
I changed Clexane to fragment.
Okay. I changed Clexane with fragment. Is that incorrect?
Yes,
I'm just asking
No.
that. Incorrect? Or no?
Yes, ma'am. Like It sounds like we are prescribing him both. Like, let's say,
No. I changed. I said I changed
did.
Clexane with Fragment. It's not incorrect. I changed Clexane to Fragment. Not incorrect. Don't complicate it. It's simple. Keep it
Okay.
simple. All right. Don't worry about it. Okay. Last thing. And you would write the conclusion for me. Let me read it. All right. Just the conclusion, or not. You would not write the conclusion. You would just say the conclusion. You would just tell me the conclusion because we're about to end this. It's been 2 hours. Okay. John comes to the surgery for results. Any questions till now, please? Any questions?
No.
Okay. Good. I'm happy that there are no questions, but I'd be more glad if there is one. John comes to surgery for results of a latest ultrasound, advises he has not smoked at all since last visit. None of you wrote that he was given smoking pamphlets. I mean, this GP has been seeing him for so long. He never gave him the pamphlets and he never listened to him. It's a big change. You need to write that he's reduced the smoking. Please note, he has reduced smoking to 2 cigarettes a day. It's a big development. Think about it. A person is coming to you for all his life. You tell him, don't smoke, don't smoke, don't smoke. He doesn't listen. Then he goes to the clinic of someone else and they give him pamphlets and he stops smoking. Isn't it a big change? You need to write that. That's so important. Okay? All right? This is a progress that you're writing. This progress I would want you to write in your letter. The rest of the progress doesn't matter. This progress matters. John comes to surgery for results of latest ultrasound, advises he has not smoked at all since last visit. He is keen to fly back to Melbourne early February when his university course recommences, persistent soleus thrombus, no significant changes, but evidence of small decrease in size. On this objective, everything is normal, tenderness and cough, decreased tenderness, injection site improved, but still some redness and irritation of the skin. Okay. Advise patient to cease fragment injections, to take half an aspirin daily, flight to Melbourne in early February, elastic stockings, exercise during flight recommended, fragment injection prescribed to be given pre and post flight. You guys have 5 minutes to write the conclusion, just 5 minutes, that's it. I'm giving you all 5 minutes, please write the conclusion. 5 minutes, your time starts now. I'm not going to give you any more time, and I mean it. Type it, write it, whatever, just 5 minutes.
Last visit?
Sorry?
What does conclusion include? The last visit?
You tell me. You
The
tell
last
me.
visit and the request?
You tell me. What does the conclusion include? Because we've been doing this since a long time. I've given you access to everything. You guys have to watch it. You guys have to understand it. You guys have 5 minutes. Your time starts now. All right, Dr. Amber, I hope I'm not being mean, but it is kind of fun, no? If you were in my place, you'd like it. All right, Dr. Amber? Okay. Time starts. Time starts now. Zahra, are you there? Dr. Zahra, are you there?
Yes,
Please read
ma'am.
this. Please read this.
Okay. Today, results of latest ultrasound showed persistent soleal thrombus, though he did not be smoking for the previous 2 visits. Mr.
What's
Hawood,
incorrect here? No. What is incorrect here? This is not your letter, I know, but what's incorrect here?
today results of latest ultrasound showed persistent.
Anytime you write a new paragraph, you need to write the person's name, right? All right,
Yes,
Dr.
ma'am.
Amber, are you there? Okay. Dr. Amber, are you there? Can you hear me? Can you see the screen?
Yes.
Okay. Dr. Amber.
Yes.
I cannot hear. Yeah, good. All right, Dr. Zahra, please read.
Mr. Haywood had planned to fly back to Melbourne in early February. On examination, tenderness and swelling in the right cuff had decreased.
Okay.
And your further assessment and management would be highly appreciated.
Okay. All right. Thank you, Dr. Zahra. Dr. Amber, this is good, but where is the thing about his aspirin? Where is the thing about his Clexane? Where is the thing about his stockings? Where is the thing about his post and after flight examination and whatever that is? Secondly, you're going to write today, all right? But you know, like here I told you not to write the last visit. I want you to write the conclusion. You've just written the conclusion that Mr. Haywood had planned to fly back to Melbourne early February. He's already there. All right, he's already there. You don't need to write this with examination. All right, don't mix the things. All right, you would just write the conclusion in a way which we're going to talk about now. All right, Dr. Umber, is that clear?
All right.
Okay. All right. The last sentence is right. Your further assessment management would be highly appreciated. Also, did not been smoking is incorrect. Had not been smoking or has stopped smoking.
It was had not been. I just I don't know.
Okay. All right. Good. Then it's good. Then it's good, but it's not understandable, right? So you could just directly say he's not smoking. He stopped smoking, right? Isn't it?
Smoking for the last two visits, for the previous two visits.
No, he stopped smoking. He stopped smoking.
All right.
Congratulations, he stopped smoking. You're going to have, you know, when you're going to do speaking, there are going to be some cards where you have to congratulate the patient that he's not smoking. It's a big effort getting rid of a habit, isn't it? Yeah. Okay, good, Dr. Umber. This is good. This is good. Any questions, Dr. Umber?
No, not now.
Good. Dr. Umber, can you read this?
Mr. Hayward was advised to cease fragment injections, and he was prescribed half aspirin daily. He was advised to contact his regular general practitioner before ceasing daily aspirin dosage.
Okay. Okay, tell me, who are we writing this letter to, Dr. Umber?
We are writing to his general practitioner.
Do we have to write this? Do we have to write this if we're already writing it to him?
No, we don't need to.
Okay, Dr. Zahra,
Yes, ma'am.
do you understand that?
Ma'am, what we will not write to him? I didn't get the point.
He was advised to contact his regular GP. Who are we writing to?
Okay. Yeah, we
We're
are
writing
writing
to
to
his
the
regular GP. Before the spelling is incorrect. Right? You would say
Oh,
Mr.
yeah.
Haywood was advised to cease fragment injections and he was prescribed half aspirin daily. Before that, he is to contact you. That's it. That's where you can use the direct you. Okay?
Okay. And ma'am, I have a question. Please. I just cut off the points like what I wrote about the flight. So should
Right.
I write?
You
Like,
should
should
write
I
that.
write about this or not?
Otherwise, how would he know? This
That
is
he
important.
was
It's a
using
treatment.
exercise and stuff. Okay.
Treatment. It's a treatment for the
Mm,
patient. Additionally, elastic stockings and exercise during the flight was suggested, right?
okay.
Because now you're writing in singular form. Elastic stockings and
Mm-hmm.
exercise during the flight were suggested would be when you would have written like this. See, here's a difference in the sentence, two sentences. I'm saying additionally, exercise and elastic stockings were suggested. Now this comes afterwards, so I write were. But you've written exercise, so was suggested. Okay? Do you understand that?
Yes, ma'am. Okay.
Okay, he was commenced on fragment injection to be given before and after flight. This is important. You've cut this down. If you cut this down, I don't read it. This is a
Yeah.
good conclusion, by the way. Just don't write
Yeah,
the
I
direct
just thought that
letter.
we are just wrapping him again to his GP, so we will
But
just
the
write
GP
that
doesn't know. But the
about the.
GP doesn't know. Did the GP know he had DVT? Did the GP know that he is, coming in a flight and he has to exercise? Did he know that he needs elastic stockings? No. They
Okay.
need to know how was DVT prevented further on. Because what
Mm-hmm.
started as DVT? He's flying back. He's flying in a plane. He's again
Okay.
taking the same flight. What did you do to stop that? Yeah, you gave
Okay.
him stockings. Clear?
Yes,
Dr.
ma'am.
Moss,
Okay.
can you read this? Good. Dr. Moss, can you read this?
Yes, madam. On 23rd January 2008, Mr. Haywood
What is incorrect?
reported, yes, Haywood spelling is incorrect.
Okay.
Haywood reported regarding his
Is
smoking
it
cessation.
reported or reported? Don't take side of your friend. Is it reported or reported?
It's reported.
Dr. Zishan, are you there?
Yes, ma'am.
Revolt.
Okay. All right. Go, Dr. Moss.
Regarding his smoking cessation, his ultrasound
What
report,
reported? What is incorrect? Did he tell you what happened? Mr. Haywood reported regarding his smoking cessation, good, but it's better to say Mr. Haywood reported that he stopped smoking. Be simple. This is also good, by the way. Okay, let me take my words back. This is good. All right, go ahead, Dr. Moaz.
His ultrasound report depicted.
Report? No, if you read like that, I'm not going to check your letter. If you're correcting his sentences before me correcting it, I'm not going to read your letter.
His ultrasound reported depicted that small decrease in size of thrombus. On examination, there was decrease in tenderness.
Correct it for me. Please correct this for me. Correct this sentence for me.
His
I'm tired. Correct the sentence, yes.
His ultrasound report depicted a small
decrease, right?
Decrease in size
Dr.
of.
Zishan, are you following us? Because you get to check his letter, yeah?
Okay, ma'am.
You would take your revenge. Don't worry, you're gonna take your revenge, okay? All right. Okay. What else? All right, go ahead, Dr. Moaz. What is incorrect? What is incorrect? What is incorrect?
On examination is right.
What is incorrect? The O is very small. Look at his
Very
O
small.
here.
Yes.
He's right. Oh, this is such a big O. Now look at the O over here. It's so small. Dr. Zishan, please don't be miser. Be very nice and be very, what is called, I don't know what is Sakhi called in Urdu. I totally forgot that. Okay, go ahead, please.
On examination, there was decrease in tenderness and swelling in the right calf.
There was a decrease in his swelling and, all right, there was decrease in the tenderness and the swelling of the right calf. He was advised
to stop injection fragment, and he was prescribed aspirin half tablet daily. He was allowed to fly back to Melbourne.
Good, very good, Dr. Zishan. What have you missed here? Dr. Zishan, what have you missed here?
मैम इसको कंप्लीट करना था अभी, लेकिन वो टाइम
English, yes.
Ma'am, I missed here, like he was allowed to fly back with stocking and injection fragment to be given after and pre-flight. Hello.
All right, Dr. Zishan, this is good. This is good. Exercise, heparin, etc., etc. Right? You forgot
yes,
that.
Yes, ma'am. I was about to write that.
No,
but
when the time's gone, there is no about. When the time is gone, there is no about. Okay. All right. It's your turn, Dr. Zishan, to take the revenge. Please read it.
Today, Mr. Haywood reported that he has not smoked at all since last visit. And
Since what? Okay. Please correct it. Please correct it for me. What is wrong?
At all since last visit.
What is incorrect here? What would you add here? Since his last visit. Okay, go ahead.
And he's keen to fly back to Melbourne next month. His ultrasound illustrated persistence.
Okay. What is incorrect? What is incorrect?
His ultrasound
Anybody can tell me
report.
what is incorrect. Anybody.
His ultrasound report.
What else is incorrect? Can anybody tell me what is incorrect?
Illustrate.
Jaldi. Quickly, guys. It's been more than 2 hours. No. Just a small subtle mistake which none of you are noticing. Dr. Amber, Dr. Zahra, Dr. Rabia, Dr. Zishan, Dr. Fasi, Dr. Moaz, what is not written here? Did I forget someone's name? Dr. Zahra? Let me zoom in for you. What is incorrect?
E.
E. Yes, where's the E? They are going to look at it and they're going to give you, they're going to mark you against it. Persistent. Right? Spellings are important here. Okay? Okay, go ahead.
Persistent soleal thrombus, but relatively small sized. Small
What is
size,
incorrect? Okay, no, that's all right. What is incorrect? Can you spelling Dr. Zishan, Dr. Moaz?
but relatively a small size.
Okay, all right. Dr. Moaz, are you there?
Yes, madam.
Can you?
RELATIVE.
Good. But it doesn't matter now. You've already written it. Be very careful about this, all right? Okay, go ahead, Dr. Zishan.
He was advised to stop injecting the fragment,
Mm-hmm.
and he was commenced on a half tablet of aspirin daily.
Mm-hmm. Go ahead.
He was allowed to fly with recommendations of using elastic stockings and exercise during flight.
Mm-hmm.
A pre and post flight fragment
A pre-what?
injection was
And a pre-what? And a pre-what? A
Pre-flight.
pre-flight and a post-flight. Between pre and post, please use a dash. Fragment injection was also advised. Now, you know what you've done, Dr. Moss? You've done a very good job, first of all. Secondly, why do I want you to write regarding? Because instead of about, right? Whenever you use the word recommendations, use regarding. Right? Why? Because you can write three, four things together. Let's see how that is, right? He was allowed. Thank you so much, Dr. Zishan, for reading your friend's letter. So he was allowed to fly with recommendations regarding use of elastic stockings, comma, exercise during flight, comma, or and injecting fragment pre-flight and post-flight. Full stop. Has it made it better? Do you have to think of
Yes.
so many things? Use regarding. I'm not an idiot that I told you all the time. All right. Okay.
Okay.
Okay. All right, Dr. Rabia, I'll just read yours. Today, ultrasound report reveals persistent solar thrombus with evidence of decrease in size. Very good. On examination, swelling in tendons. Dr. Rabia, in here, what I want you to do first is make sure that your writing of doctors is good, but please pronounce your words, letters. Is there any E in this spelling? Dr. Rabia, are you there?
Yes, ma'am.
Please pronounce your E's, your words, right? I have almost the same writing. I have the worst writing, but just for my OET exam, I made sure that I pronounced and I emphasized and I embossed on my letters, right, on my words. Okay?
Okay, ma'am.
You understand that? Otherwise, it's good. I advise. Now, please watch the whole lecture again. Instead of saying I advise, we rarely use active sentences. Half of our letter is passive and in past tense. All right. I advised him to take aspirin daily with fragment injection before and after the flight. Good. He was also advised to contact whom?
You.
Okay, good. Contact you before stopping daily aspirin dosage. Okay. All right, this is good, guys. Any questions regarding this letter?
I wanted to ask a general question.
Go ahead, go ahead.
Like we write initially, Mr. Haywood presented with complaints of progressive, and we can also write Mr. Haywood presented with a progressive pain. So writing complaints of is necessary.
No. Do you think it's necessary?
No.
Then don't do it. You know almost everything, right? You just need a little bit of tweaking here and there, right? Okay.
Okay.
You guys are doctors. You guys have been doing English for a long, long time. Not doing, English for a long, long time. So there is nothing that I'm teaching you. I'm just doing tweakings here and there. Yeah? Isn't it? Have I taught you something new? No, you know everything
Yes,
already.
a lot of things.
Sorry, Dr. Moaz, your voice is cutting off.
Yes, you have taught us a lot of things. These
No,
all
no,
things
not really, not really.
we forgot.
No. That's okay. That's okay. This is why I want you to keep on going again and again. All right. Let me just read the last thing for you. Just a last visit. All right, for all of you. You're going to say, today, Mr. John presented with the results today. No. First, I'll say what he has been doing, right? Today, Mr. John reported that he had stopped smoking. He stopped smoking, that is. He stopped smoking. And his ultrasound results revealed a persistent soleal thrombus. Okay, let me just point it out. Okay. All right, just a minute, please. Okay. Okay, so here it is. It is written, today, Mr. Hayward presented with, today, Mr. Hayward reported that he had stopped smoking. His ultrasound revealed a persistent soleal thrombus with a small decrease in size. His examinations were normal. However, there was a decrease in tenderness and swelling of the right calf. All right. Along with that, the allergy has improved. Okay, allergy has improved. Okay, the allergy site has improved. Okay, all right, that is it. That is it. The ultrasound, we've done that, right? Okay, then we're writing. Now we're writing the conclusion. You're saying, I believe Mr. Hayward has, whatever you think he has, or he had DVT. I believe that Mr. Hayward is ready to fly back home. Isn't it? Now we're doing a conclusion. I believe Mr. Hayward is ready to fly back home, and he has been commenced on aspirin. All right, or I could say, I believe Mr. Hayward is ready to fly back home. All right, or he's ready to fly back to Melbourne in the early February, and he's advised to use elastic stockings, or he has been advised regarding use of elastic stockings. All right, exercise during flight, and fragment injection pre-flight and post-flight. Full stop. Please note he has been commenced on aspirin, which he would stop after contacting you. Full stop. That's it. Also, you write about the fragment in the last sentence. Any question, guys? I hope there is not one question. We're going to do transfer letter now. Just give me a minute, okay? Any question? I know it's too late. It just takes 5 minutes.